Officer. Higher costs, higher prices and job losses. Austerity on stilts from the Labour Government, and this is not the change that we were looking for. Charities and businesses are closing in our communities as a result of this policy, and the hike in national insurance will have a dire consequence on organisations in every community. My Labour colleagues must be getting the same emails and phone calls that I am from local businesses, charities, local hospices and organisations in our community that are scared for their future. I convene once a quarter in my constituency the Community Action Network, which brings together the local and national organisations with a shared commitment of tackling poverty and supporting people in North Lanarkshire. They're integral to the community's well-being and the work in my community. I asked them how this tax hike would affect them, and the responses have been stark. Bernardo says it's a very significant challenge for our charity and will inevitably mean that we will have less resources to direct towards meeting the immediate needs of children. It will impact our ability to fund our crucial frontline services to vulnerable, care-experienced young people and homeless families throughout North Lanarkshire. LEMH Recycle, who is a local firm working to reduce its barriers to employer through recycling, said it was going to have an impact on the future, and planning and recruitment would need to be halted as the costs were going to be too much. North Lanarkshire Carer Together said the impact of this means that we will struggle to offer staff costs the living salary increases that they deserve over the next 5 years. Their testimony reflects the broader picture: long-term risks, losing quality, experienced staff, and for many, a reduction in critical frontline services. Turning Point, a leading social enterprise that delivers essential health and social care services across 18 local authorities, said they had a financial hit of possibly £1.2 million. It places every one of their services into a deficit or enhanced deficit position. One phrase that really stood out from the response: less funding will see less service, an apparent yet deeply important point. And Lanarkshire Links, whose work is integral to mental health advocacy in my area, informed by people with lived experience of mental health, say they expect the national insurance increases to result in significant funding cuts and threatens the job security of their team. Losing these voices, and I could go on and on, Presiding Officer, and we were promised that this would not happen. So we've been challenged this afternoon to say, how would we have filled this black hole? What would we do differently? Well, Lorna Slater outlined exactly why flip-flopping between Labour governments and Conservative governments or coalition governments has just led to further obscene levels of inequality in this country. And that's the nub of this. It's not about whether you have a choice of doing this or increasing taxes elsewhere. It's about having a vision for a more equal and fairer society, one that embraces universal services and one that is built on reducing the inequalities faced by the poorest people in our communities. And you would think those calls would be coming from the Labour benches, but it's Oxfam that's leading the fight on this. And if they wanted to know how we could do it, well, we appreciate the non-DOM's position has gone, but how about looking to the advice of the World Bank and looking at our tax system, so complex that there's so much tax avoidance and fraud in there? A simplification could reduce the impact of this completely. And I believe that the vision needs to be there for a stronger, fairer, more equal society. Thank you, Presiding Officer.